No one ever taught us that illness doesn't always begin in the body. Sometimes it begins in silence, in omission, in the things families never talk about. They taught us inheritance meant names, property, and traditions. They never taught us that the body keeps its own records, that history doesn't always live in books. Sometimes it lives in blood. This is a story about families, not individuals, about patterns mistaken for coincidence. History repeated so quietly that no one noticed until it was too late. Because what goes unspoken doesn't disappear, it waits. For most of human existence, families were their own archives. There were no centralized records, no long-term documentation, no shared system for tracking health across generations. What people knew came from observation. A mother who weakened earlier than expected. A father whose strength faded too soon. Children who mirrored struggles they were never warned about. But these observations lived only in memory, and memory is fragile. In many cultures, discussing illness openly was considered dangerous emotionally, socially, even spiritually. To speak of weakness was to invite shame. To acknowledge patterns was to admit vulnerability. So families adapted. They renamed reality. Instead of saying this runs in our family, they said, it's just how we are. That's normal for us. It happens to everyone. Normalization became survival. Silence, passed down like tradition, became protective. Parents withheld information, believing they were shielding their children.
I remember
Grandparents
when we were this
softened
small,
stories,
you two were
believing
always so
details
close.
We
would
still
only
are,
cause
Grandpa.
fear.
That's what
But
matters.
protection has a cost. Without shared knowledge, every generation faced the same surprises alone. And history repeated itself without explanation. Across continents and centuries, the same quiet tragedy unfolded. A grandparent's decline explained away as age. A parent's struggles are framed as bad luck. A child's challenges are
It's
treated
okay, I'm here.
as an
I'm
unfortunate
scared,
twist of
Ma. I know,
fate.
sweetie. It's all
Each
right now.
generation believed they were the first. Medical systems focused on the present moment. Families focused on endurance. No one connected the threads. The tragedy wasn't neglect. It wasn't cruelty. It was fragmentation. Lives lived as isolated chapters instead of parts of a single book. There were chances to notice, moments when similarities surfaced too clearly to ignore, times when someone would say quietly, "This reminds me of," and then stop. Because finishing the sentence felt dangerous. What if it meant something? What if it couldn't be undone? So, the sentence remained unfinished, and history continued uninterrupted. Eventually, repetition breeds discomfort, questions that refuse to stay buried. Why does this feel familiar? Why does this story sound like one I've heard before? Why does distance fail to break the pattern? Families separated by time, geography, and circumstance still echoed one another. Coincidence began to feel insufficient. What if families weren't repeating stories by chance? What if the past was living clues? And what if those clues had always been there, waiting to be recognized? The idea didn't arrive dramatically. There was no single moment of realization. Instead, it crept forward through observation. In the late 1800s and early 1900s, researchers studying heredity noticed something unsettling. Traits didn't vanish just because they weren't visible. Some appeared immediately, others waited. Some skipped generations entirely. This contradicted the belief that inheritance was obvious and predictable. It suggested something quieter, something patient. Families, it seemed, carried information forward whether they acknowledged it or not. The idea was uncomfortable. If patterns could be inherited, it challenged ideas of control, blame, and randomness. People feared what it implied, that the past wasn't finished with them, that history could reach forward. So resistance followed, but evidence accumulated not loudly, not quickly, but steadily, across families, across decades, across borders. Slowly, family history stopped being just storytelling. It became context, a way to understand repetition without assigning guilt, a way to see continuity without surrendering to fear. The idea wasn't that history dictated outcomes, but that it informed them, and that difference mattered. Families began to be seen not as isolated individuals, but as timelines. Each generation, a chapter, each story connected to what came before. What elders experienced mattered beyond memory. What they endured carried forward. Legacy was no longer just inheritance of property or names. It became an inheritance of experience. Today, family and genetic health history sits between science and storytelling. We have better tools, but incomplete memories. Better language, but lingering silence. Many families still don't talk, not because they don't care, but because silence was inherited too. History remains fragmented, and the story continues. The question is no longer whether families carry history. The question is whether we're willing to listen to it.